Hi, Banu. Welcome back.
Hello.
I see you were in a year ago for a half mouth scaling and root planing. Does that sound right?
Yep.
Okay, so great. You might be familiar with some of the things that we are about to talk about today, but do you have any immediate concerns or questions regarding your oral health?
I noticed I had a throbbing pain in the left side of my mouth.
Oh, no. Okay. Yeah, we'll definitely take a look at that. I see that you did have your molars extracted on your other side, so are these similar symptoms to that? Okay, sounds good. We will definitely take a look at that because we don't want you to lose those teeth. Obviously, I'm sure you don't either. But let's just start out. So do you have, are you familiar with gum disease, gingivitis, periodontitis? Have you heard any of those words before?
Yeah, I remember them telling me at my first appointment, but I feel like I could use a refresher.
Okay, sounds good, definitely. Okay, so I'm going to use this flip chart just kind of to talk or show you, give you a visual of what kind of infection we're talking about. So here we have healthy gums, a healthy tooth, healthy bone, nothing going on here. You can see the bone fully supports the tooth. You can see there's no redness, no inflammation, and we use the this kind of like ruler tool called a probe to measure your gums to make sure that they're healthy. So you can see that this measures 0 to 3 millimeters. So, and then you can see up here, no recession, nothing major going on. Then the next one is gingivitis, which you said you've heard of before. And basically with gingivitis, you don't have any bone loss at all, which is great because that means that gingivitis can be treated if caught early enough. So you see our probe, it's measuring a little deeper than 0 to 3. It looks like it's about 4 millimeters, and then you just have some inflammation, some irritation going on, but still nothing major. Just if we see that, we'll educate you on that, and then hopefully that will go away over time. Now we get into periodontitis, which is what you have been diagnosed with. So you have early periodontitis, where you just start to have a little bit of bone loss. You see a little bit of the bacteria building up, which we'll talk about in a minute, and you just see a lot more inflammation, redness going on. You can look up here. And then our probe is measuring about 5 to 6 millimeters. Right, and then we go into moderate periodontitis. You just see a lot more bone loss, a lot more buildup. Tissues are super inflamed, super irritated. Probe is measuring about maybe 6 to 7 millimeters. And then you can see up here you got some recession, bones starting to show a little bit. And then when we go into advanced periodontitis, which is what you have been diagnosed with looking at your radiographs and past history, you see a lot more bacteria, you see bone loss, redness, inflammation, and that probe is measuring 7 millimeters or above. And then looking at your probing chart, that's definitely what you have. So we want to be able to treat that as much as possible, manage it, and so let's talk a little bit about that. Do you have any questions so far?
No, the flip chart all sounded a little familiar, bringing it back
Good.
the first appointment.
So, do you know what causes periodontitis at all, or why you might be presenting with some of the symptoms that you are?
I feel like it's a lack of oral care.
Lack of oral care?
Yeah, for sure. I don't have professional visits, so I don't get a typical cleaning.
Routine visits, for sure. So basically, over time, if you don't go in routinely for dental visits, you'll have bacteria. So you've heard of plaque before. Mm-hmm. So you'll have this bacteria kind of build up below your gums, which is oftentimes why we can't see it, not as hygienists, when you can't see it just when you're brushing your teeth in the bathroom and stuff, is because it's all below the gums. So it takes a while to build up over time. But basically, plaque will harden into calculus or tartar, and then that will cause more plaque to build up over time. You'll just have eventually this buildup of calc. And that bacteria buildup causes your gums to become super irritated and basically just causes this infection that we call periodontitis. So that is that. And then, so you looking at your probe or your perio chart and your radiographs and everything, we have diagnosed you with severe aggressive periodontitis just because of your age. So we talk about like calc building up and that being the reason for it, but we also have risk factors, which do you know what those are?
Heard of them.
Okay, so that basically just will put somebody more at risk for getting periodontitis. And so you can look a little bit beyond just like typical oral healthcare and professional visits as to see just a comprehensive view of why you might have this disease. So looking more into your history and your notes and stuff, you do have heavy subgingival calculus in all four posterior regions and lower anterior region, which is your lower teeth right here. Posterior regions meaning your back teeth, so where you lost your 2 teeth before and where you're having some of your symptoms before, there's a lot of that bacteria buildup back there. So there's that, and then your age, actually age is a risk factor for perio, so being that you're 35 years old, 35 and above can put you more at risk, but being that you are on the very bottom of that, we say that you have more of an aggressive perio right now as opposed to a chronic type. And then we also saw, and then you do, stress can put you at risk too, so you're pursuing your doctor research, which is awesome, but all of that added stress can also put you more at risk for this infection or just worsen it over time. And then we did find some food impaction in your back teeth as well. So we'll take a look at that. I know that you were in a year ago for half mouth scaling and rip planing, so you might be a little bit familiar on how to treat periodontitis, but I'm just going to give you a reminder on what our plan is for you moving forward. So you've heard of scaling and rip planing, and we're planning to do that in all 4 quadrants. Even though you're in a year ago, we saw enough calc that we want to get rid of all of that and hopefully just make your teeth less irritated. So we're going to start out on one side of your mouth just because of anesthesia purposes. Mm-hmm. If we're going to numb your mouth, which, were you numbed last time?
Yes.
Okay. So we're going to numb your mouth again, and we just want to numb half of your mouth, which makes the most sense. And then we're going to start in quads 2 and 3, actually, because you just had this a year ago. And then we're going to go over to the other side of your mouth. Those appointments will take, half your mouth will take the whole clinic time. The other half will take the whole clinic time. You'll have to come back to separate visits for that, obviously. And then once that is done, we're going to have a 6-week tissue check to see how successful the scaling and rip planing was on your mouth. Look at your probing depths, all that good stuff, and then see where we're at to evaluate if there's further treatment needed. So,
like a referral to a surgeon, or?
Yeah, so if you come back and depending on what your tissues look like, we might want to refer you to a oral surgeon or a periodontist to for sure look at those back molars to see if you're going to need those extracted, just because we don't want those teeth staying in there if they're going to just cause more of the infection to worsen.
Right.
So we're going to take a look at that, and if your pocket depths don't reduce, you might want pocket reduction surgery too to look into something like that, and that's when we would also refer you to a periodontist. So we'll see after those 6 weeks what they look like. After the scaling and rip planing, so we also have another agent that we use in helping to treat this. Have you heard of Arrestin before?
Sort of.
Okay. So it's basically just an antimicrobial that comes in like little tiny tubes almost, and we squirt it right into your sulcus, so those pockets that we talk about, we squirt it right in there into pockets that measure 6 millimeters or above. So we'll be doing that after both of your treatments. It's basically just an antimicrobial, hopefully reduce that pocket a little bit, heal it up a little bit. And then we'll check and see how effective that was as well. Do you have any questions regarding the Arrestin?
No, I feel like that sounds really good.
Yeah, awesome. Okay, so, and then we talked about pain control a little bit, so the local anesthesia will administer, I don't know what they did last time, but we'll do a topical, and then we'll just inject straight into your mouth, and you'll be numb for the procedure.
Perfect.
And then the scaling and rip planing, basically, I'm sure you remember this from last time, but we're just cleaning, we're just going below your gums, we're getting all that buildup out. That's why it takes a little bit longer. We're trying to clear all that calculus away, or that tartar that we talked about, and just hopefully restore your gums to a more healthy state. And then, so we want to talk about the prognosis and the risk of non-treatment. You don't seem like somebody who would just walk away and never come back again, but we do want to talk about just it's super important to get this treatment as soon as possible, just because we don't want you to lose more of that bone that you already have, risk losing more of your teeth. We just want to basically stop the infection from growing and then just maintain it. Since it's not going to be 100% treatable, we can't regrow bone. We wish we could, but we just want to maintain that as much as possible. Do you have any questions about that?
No.
Awesome.
I feel like I want to get back to health, so...
That's what we want for you, too. All right, so we've talked about all of the treatment. We're just going to talk about the fees now. So the scaling and root planing at our clinic costs $120 per quadrant, but because if you pay the same day without insurance, it'll cost $35 per quad, which is really good for our clinic, and then the Arrestin that we talked about is actually free.
Oh, nice.
So, and then after the 6-week tissue check, and if you have to get referral to the oral surgeon and the periodontist, eventually we're going to put you on a perio maintenance recall appointment. So that happens every 3 to 4 months. Most people just go to the dentist routinely 6 months, so twice a year, but because you have been diagnosed with this infection, we basically just want to keep a close eye on you. We don't want that to get any worse. We just want to maintain it, so we put you on these perio maintenance appointments every 3 to 4 months that you just come in. We make sure everything is going well. We just give you a cleaning, and then watch your bone levels as well.
Is that just because I'm at a higher risk?
Yeah, okay. You're just at a higher risk for that condition to worsen, or yeah. And then what you do at home and your role in this disease matters 100%. We can only educate you and perform these cleanings every 3 to 4 months or 6 months, whatever, but you are in charge every single day of making sure that you are doing your part at home. And we just really appreciate that with with patients, making sure you are flossing routinely and brushing your teeth routinely and using or a fluoridated mouth rinse. A fluoridated mouth rinse twice a day as well, just to make sure. And then that will help control your infection for sure. Do you have any questions?
No.
All right, one last thing that I wanted to talk about today was, so when you get this scaling and root planing done, we'll send you home with a sheet of just post-op instructions, just because you'll be a little bit sore because we've been doing so much deep cleaning below your gums. You might be a little bit irritated. You'll be still a little bit numbed up from the anesthesia and stuff. So we'll send you home with instructions, but basically I just want to give you a couple of pointers of what you might see. You might just have some mild discomfort following that appointment. You can definitely take ibuprofen, Advil, whatever, just pain reliever to relieve that for those days. And then we do recommend saltwater rinses 1 to 3 times per day to help. And then you just may experience some tooth sensitivity. And then you want to make sure that you're not chewing super hard foods or anything like that. Just keep it more soft. And you can brush and floss immediately after. And just if you go home and you have any concerns or questions or something you think kind of strange or weird starts happening, just don't hesitate to call our clinic or come in, whatever, and we'd love to see you and help you out and answer any questions.
Perfect.
But it'll be good. We'll get you back to healthy, a better state, and yeah, thank you so much for coming in and listening to me.